Welcome everyone. Today we will talk about how to take care of older adults. This talk will guide you step by step through the key ideas that help us care for older people. Older adults often have many health needs, and sometimes even small problems can grow into big issues if we do not pay attention early. So this talk will show you an easy and simple approach that can be used in hospitals, clinics, nursing homes, and even at home. So let's start. So geriatrics around the world. The emergence of geriatrics began in mid-20th century. It was driven by recognition that many older people in institutions had untreated conditions and those improved with careful assessment and rehabilitation. As evidence grew that illness presentation and treatment responses differ in older adults, geriatrics expanded to hospitals and communities. However, its development has been uneven worldwide. Some countries lack the specialty entirely, others limit it to major academic centers. Training structures also vary. Some countries require formal multi-year programs and certification examinations. Others rely on national societies or have no defined pathway. Geriatric services similarly range from national coordinated models to highly variable fragmented systems across health professions. So I will begin with different topics included in gerontology and geriatrics. This first section introduces the scientific foundations of aging, that is gerontology. Gerontology is the science of aging. It is the bedrock, and geriatrics is the discipline which deals with medical care of older adults. That is translational outcome of gerontology. In gerontology, we discuss how the body changes over time, how long people live, and how aging affects immunity, psychological aspect, and social factors. These chapters help us understand why older adults experience illness differently, and they set the stage for geriatric care by showing how biology, society, and behavior shape the aging journey. Next part is the principles of geriatrics. This part explains practical approach to caring for older adults. It covers assessment, age-friendly care models, nutrition, sensory function, safe management, surgery, and medications. These chapters show how to evaluate the whole person, not just a disease. They guide us in delivering coordinated, respectful, and safe care across all healthcare settings for older patients. Now, part 3, here we discuss common conditions faced by older people. For example, frailty, falls, sleep problems, dizziness, pressure injuries, incontinence, cognitive decline, elder mistreatment, mobility issues, and mental health. These conditions often occur together and need a careful person-centered approach. Understanding these syndromes helps clinicians detect problems early and prevent avoidable decline. So part 4 is palliative medicine and ethics. This section focuses on comfort, symptom relief, communication, and ethical decision making. It covers pain control, managing non-pain symptoms, supporting patients with serious illnesses, and discussing goals of care. Ethical topics include consent, autonomy, and compassionate choices. These chapters highlight the importance of dignity and quality of life at every stage of aging. This final part reviews the age-related changes in all major organs, and it includes heart, lung, kidney, digestive system, cancer, blood, hormones, joints, and infectious diseases. So older adults have several chronic problems at once. So these chapters help clinicians to understand complex interactions, design safe and realistic treatment plans tailored to each patient's condition and goals. So you can actually say that this is geriatric cardiology, geriatric pulmonology, or geriatric nephrology, like that. So by this time, you know that what are the main topics of geriatrics, including gerontology. Now let's discuss what should be our approach. Approach may vary widely, but here I am going to discuss a very simple and easy approach. So why does caring for older adults matter so much? Because older adults are one of the fastest growing groups in the world. Many countries, including ours, now have more older people than before. And we see more long-term illnesses, more medication use, more complex health needs. So older adults often have several conditions at the same time. For example, they may have diabetes mellitus, high blood pressure, joint pain, and memory problems all together. When several problems happen at once, even a small change in health can cause a big decline. A simple cold can turn into confusion. A minor fall can cause fracture. A new medicine can cause dizziness and poor appetite. That is why a gentle and thoughtful approach is important. We cannot treat older people with the same mindset we use for younger adults. We must slow down. We must listen more. We must look closely at small details. And another important point is quality of life. Many older adults do not want aggressive tests or painful treatments. They want comfort, independence, and dignity. They want to stay active, stay connected, and stay in control of their choices. So, when we talk about approach to geriatric care, we are really talking about respect. Respect for their body, respect for their mind, and respect for their wishes. Caring for older adults is not only medical work, it is a human work. So we must remember this. When caring for older adults, it helps to understand life expectancy. Life expectancy is the average number of years a person of a certain age might still live. This is not a prediction for each person, but it helps guide decisions. In many countries, women live longer than men. For example, an 80-year-old woman may live several more years than an 80-year-old man. This difference is important when we talk about treatments, screening, or long-term planning. Understanding life expectancy helps us decide what tests are helpful and what tests may not be useful. For example, Cancer screening takes many years to show benefit, which may not be helpful for someone with limited life expectancy. Instead, we may focus on comfort, independence, and symptom control. Life expectancy also helps us speak with the patients and families about goals of care. And when we know someone may live 5 to 10 more years, we may focus on long-term plans, injury prevention, and healthy habits. But when life expectancy is shorter, we may focus more on comfort care, safety, and emotional peace. But it is important to remember life expectancy is only one part of the picture. Each person is different, and some 90-year-olds are strong and active. Some 70-year-olds may be weak or frail. So always look at the person, not just the number. Using life expectancy wisely helps us give care that is realistic, kind, and meaningful. So there are a few basic rules that guide all geriatric care. These rules make the care safer and more effective. The first rule is that many problems in older adults have many causes. For example, dizziness may be caused by poor vision, weak muscles, dehydration, and medicines, all at the same time. So we must look for several causes, not just one. The second rule is that illnesses often show up in strange ways. An older person with a chest infection may not have cough or fever. Instead, they may show confusion or a fall. This is atypical presentation. And the third rule is that not all abnormal finding needs treatment. Many older people have harmless changes like mild anemia or bacteria in urine without any symptom. So treating these unnecessary conditions can cause harm. And the other rule is that many chronic conditions and geriatric syndromes happen all together. For example, frailty, falls, memory loss, and incontinence often occur in the same person. So we should manage them together, not separately. And these principles may seem simple, but they change how we think. They remind us to slow down, to look broadly, and treat the whole persons. So when we follow these rules, care becomes safer and more compassionate. So one of the biggest challenges in caring for older adults is that illnesses do not always appear in usual way. This is called an atypical presentation. So a chest infection may show as confusion, weakness, or a fall. A heart attack may show as shortness of breath, dizziness, or simple fatigue. An urinary infection may show as behavior changes or agitation. These unusual features make diagnosis challenging. The reason for these strange presentations is that older bodies respond differently. Their immune system may be weaker, so they don't develop fever. Their nervous system may be slower, so they show confusion instead of pain. Their muscles may be weak, so they fall easily when something is wrong. This means we must always be careful when we see confusion, new falls, sudden weakness, incontinence, or loss of appetite. These are warning signs that something is wrong, something is serious may be happening. When in doubt, we should think broadly. Check for infections, look for medications, review hydration, and assess for pain. Using a gentle, wide approach helps us find the real cause without missing important problems. So understanding atypical presentations can save lives. It helps us identify illness early, avoid mistakes, and give better care. As I told, many health problems in older adults have more than one cause. This is why we say they are multifactorial. They have multimorbidity. For example, dizziness may not come from just one issue. It may be due to low blood pressure, poor eyesight, weak muscles, dehydration, or side effects of medicine. When several problems happen together, they create one big symptom. Because of this, treating older adults often needs several small steps, not one big fix. We might improve vision, give more fluids, adjust medicines, and provide simple exercises. When we treat several causes at once, the patient often gets better faster. Older adults also lose strength and reserve over time. Their body cannot adjust quickly to stress, to illness, or to changes. Even small changes like a new drug, a missed meal, or a minor infection can push them into weakness or confusion. This is why we must look at the whole picture. We cannot focus on one organ or one laboratory result. We must see how the body and mind, environment, and medicines all interact. When we think in this broader way, we can prevent many problems before they become serious. Multifactorial care may look slow and gentle, but it is powerful. By making many small improvements, we help older adults stay stronger, safer, and more independent. So the 5M's framework is a very simple but very helpful way to care for older adults. It covers the 5 key areas: mind, mobility, medications, multicomplexity, and what matters most. Mind refers to memory, mood, and thinking. We must look for dementia, depression, and delirium. All three are common and can greatly affect daily life in older adults. Mobility is about walking, balance, and strength. Falls are a major risk in older adults, and good mobility assessment can prevent injuries and improve confidence. Medications cover all the drugs a person is taking. Older adults often take many medicines. Some are harmful, some no longer needed, and some may interact. So we must keep the list simple and safe. And then comes multicomplexity. Multicomplexity means combination of many illnesses or multimorbidity, social challenges, and functional limits. We must understand how all these parts connect. Treating one problem without looking at the others may cause harm. And finally, what matters most is the most important aim. We must ask, what are the person's goals? Do they want comfort? Do they want independence? Or do they want fewer medicines? Older adults are deeply careful about quality of life. The 5 M's help us talk, think, and act in a more person-centered way. When we use the 5 M's every time, we give safe, thoughtful, and meaningful care. What matters most? This is the heart of good geriatric care. Older adults have different goals than younger adults. Some want to stay independent at home. Some want to avoid hospital stays. Some want good pain control. Some want to spend time with family without stressful treatments. So when we ask simple questions like what matters most to you right now, we learn what the patient truly wants. This helps us guide our treatment plans. For example, an older person with advanced dementia may not want feeding tubes or aggressive care. Another older adult may want strong treatments because they hope to stay active longer. So understanding what matters most also helps us avoid unnecessary tests and unnecessary treatment. If a test will cause stress but no change of care, we may choose not to do it. For patients with serious illness, these questions becomes even more important. What types of care brings peace? What symptoms cause the most distress? What fears or worries need attention? Talking about goals shows respect. It builds trust. It helps families make decisions together. It also reminds us that medicine is not only about the numbers or scans, it's about people. So when we combine medical knowledge with personal goals, care becomes more human and more meaningful. This is why what matters most is the guiding star of geriatric care. Next is comprehensive assessment. A comprehensive geriatric assessment or CGA is a full checkup that looks at many parts of an older person's life. It is not just a medical exam. It reviews physical health, mental health, function, mobility, social support, home setting, and more. We start with medical problems, but then we look at how these problems affect daily life. Can the person bath, dress, cook, or move safely? Are they eating well? Are they sleeping well? Are their mood and memory okay? Do they feel lonely? Do they have someone who helps them? We also look at mobility. Can they walk safely? Do they use a stick or walker? Do they feel afraid of falling? Next, we review all medicines. Many older adults take more than 10 or more drugs. Some may no longer be needed. Some may cause dizziness, confusion, or a low blood pressure. So a simple medication review can prevent many problems, many issues. We also assess the home environment. Are there loose rugs, poor lighting, steps without railings? These small details can cause big injuries. So a comprehensive assessment takes time, but it prevents crisis. It helps us identify problems early and it gives us a complete picture so we can create a care plan that fits the person's needs, strengths, and wishes. So components of assessment. The main parts of assessment of a geriatric care include medical review, mental assessment, functional assessment, social review, and environmental safety. The medical review looks at disease conditions, symptoms, nutrition, hydration, sleep, and pain. Older adults may not report pain clearly, so we must ask gently and observe their behavior. The mental assessment covers memory, mood, and thinking. We look for features of dementia, depression, and delirium. These conditions are common and can change how a person functions. The functional assessment checks how well someone can perform their daily tasks like bathing, dressing, eating, walking, managing money, and taking medicines. So small changes in function can show early decline. The social review looks at the family support, caregiver stress, loneliness, and safety. So lack of support can harm health as much as the disease itself. The environmental assessment checks for home hazards, slippery floors, poor lighting, clutter, or unsafe furniture. So simple changes can prevent injuries. The goal is to put all these pieces together and each part tells a story. When combined, we understand the person fully. This helps us create a plan that is safe, realistic, and centered on the patient's life. Now, polypharmacy risks. Polypharmacy means taking many medicines, usually 5 or more at the same time. This is very common in older adults. Many have diabetes, heart problems, arthritis, poor sleep, and memory issues. So each illness brings some new medicines. Soon the list becomes long, but the more medicines a person takes, the higher the risk of harm. Even small doses can cause big uh, effects in older adults. Medicines can make them dizzy, confused, tired, or unsteady. They can raise the risk of falls, low blood pressure, and kidney problems. Some medicines interact with others and cause even more problems. This is why we must review the medicine list often, and we need to ask, is this medicine still needed? Is there a safer options? Can I stop something this time? So removing one or two unnecessary medicines can greatly improve quality of life. So we must be careful with certain drug groups like sleeping pills, sedatives, anticholinergic drugs, strong pain medicines, and blood pressure medicines. These can cause confusion, falls, and weakness, and many other issues. So a safe medicine plan keeps doses low, avoids risky drugs, and uses the fewest medicine needed. When we simplify the medicine list, the patient becomes safer, more alert, more steady on their feet. Polypharmacy may seem normal, but it is a serious risk. A simple review can prevent many problems, many problems. A good care for older adults must include vision, hearing, and movement. These three areas affect almost every part of daily life. Vision often becomes weaker with age, poor sight increases falls, causes fear of walking, and makes reading and eating harder. A simple pair of glasses or better lighting can make a big difference. Hearing loss is also common. It does not only affect conversations, it can cause loneliness, worry, and even confusion. When people cannot hear clearly, they may respond incorrectly or withdraw from others. So speaking slowly, facing the patient, and reducing background noise helps a lot. Mobility is another key area. Many older adults lose strength in their legs and core muscles. This leads to poor balance and falls. Falls can cause fractures, fear, and long hospital stays and a lot of complications. So to support mobility, we should check gait, balance, and strength. Encourage safe exercise, walking aids, and balance training. Even small exercises like rising from a chair several times can help. Sensory problems and poor mobility often happen together. Weak legs plus poor sight plus poor hearing can greatly increase risk. That is why we must check all three areas. When we improve vision, hearing, and mobility, we help the person stay active, confident, and independent. Multi-complexity in care. Multi-complexity or multimorbidity means many health issues happening at the same time. Older adults often have this. They may have diabetes, heart disease, arthritis, memory issues, poor eyesight, and weak muscles, sometimes all together. These problems interact, and treating one may affect the other. For example, strict diabetes control may cause low blood sugar, which can cause falls. Treating high blood pressure too much may cause dizziness. Giving strong pain medicines may cause confusion. This is why we must balance every decision. We should avoid rigid rules and instead use a gentle, flexible plan. Guidelines for young adults may not fit older adults. Instead, we must think about the big picture, how all illnesses, medicines, and daily tasks connect. We also look at prognosis, how strong or frail the person is, how long they may live. This helps guide whether we choose simple treatment or a strong treatment. We must always keep comfort, independence, and safety in mind. Multi-complexity and multimorbidity also includes social factors like loneliness, financial strain, caregiver stress, and home safety. These can also affect health as much as medical issues. When we understand multi-complexity, we stop looking at each illness alone. We start caring for the whole person. This leads to a safer, kinder, and more effective care. Choosing wisely tips. The choosing wisely tips recommendations helps avoid treatments that may do more harm than good in older adults. They remind us that more care is not always better care. For example, if feeding tubes in advanced dementia do not improve life or comfort, instead, gentle hand feeding is safer and more caring. Antipsychotic drugs should not be the first choice for behavior problems in dementia. They can cause strokes, falls, and even death. Benzodiazepines and sleeping pills should also be avoided because they cause confusion and falls. We also avoid treating urine bacteria if there are no symptoms. Many older adults have bacteria in urine, but treating it with antibiotics causes more harm than benefit. So we avoid every tight blood sugar targets. Moderate control is safer. We also avoid aggressive blood pressure treatment in frail older people because it may cause fainting or kidney problems. Cancer screening should also consider life expectancy. Some tests may not help if the person will not live long enough to be benefited, but the tests itself may cause stress and harm. So choosing wisely teaches us to think before we act. Ask, will this treatment help? Will it cause harm? Does it match with the patient, what the patient wants? This approach protects older adults from unnecessary pain, stress, and risk. It keeps care simple, safe, and respectful. So when we care for older adults, we must be careful with investigations. Not every test helps. Some tests can cause stress, pain, or confusion. A smart testing approach means ordering tests only when they change the plan of care. For example, many older adults have bacteria in the urine, as I said, without any symptoms. This is called asymptomatic bacteriuria. Testing or treating this can cause harm, such as side effects from the antibiotics. So we avoid routine urine tests unless the patient has clear symptoms like burning, fever, or pain. Chest x-rays and CT scans should also not be done unless needed. If the person is improving from, say, pneumonia, repeating the x-ray does not help and may only cause worry. Blood test should be done with a purpose. For older adults with many illnesses, some laboratory results may look abnormal always, but may not be important. A full workup for mild anemia, for example, may not help someone who has many other serious conditions. So before ordering any test, ask 3 questions. Number 1, will this test help the patient? Number 2, will the result change treatment plan? And number 3, will it cause stress or harm? A smart testing approach helps older patients avoid unnecessary procedures. It protects them from confusion, discomfort, and fear. It also makes the care more focused, kind, and meaningful. Safe prescribing is essential in older adults because their bodies process medicines differently. The kidneys may work slower. The liver may clear drugs more slowly. The brain may react more strongly to certain drugs. Because of these changes, even low doses can cause big problems. So we must be careful with certain medicines, particularly sleeping pills, sedatives, strong medicines, and anticholinergic drugs, because they can cause confusion, falls, and memory issues. This should be avoided whenever possible. Blood pressure medicines should also be used gently. Too much lowering of blood pressure can lead to dizziness or fainting. The good rule is start low and go slow. Begin with lowest dose, increase slowly only if needed. Always check how the patient feels after starting or changing a drug. We also need to check for drug interactions. Many older patients take 5 or 10 medicines. Some of them may interact and cause harm. So reviewing the entire medication list at every visit can prevent many side effects. Ask yourself, does the patient still need this drug? Is there any safer option? Or can we stop something here? Stopping harmful medicines is just as important as starting a helpful one. Safe prescribing protects older adults from falls, confusion, dehydration, and hospital visits. It keeps care simple, safe, and focused on quality of life. And overtreatment is a big issue. Overtreatment happens when we continue tests or treatments that may no longer be helpful. For older adults, they are more sensitive to harm from strong treatments. So we must be mindful. As I told, very tight blood sugar control may be helpful for young adults, but it can harm older adults. Low blood sugar can cause falls, confusion, and even coma. Moderate control is always safer and still effective. The same idea applies to blood pressure. Aggressive treatment may cause dizziness or kidney injury. A softer, balanced approach is safer in older adults. And as I told, cancer screening is another area where overtreatment can occur. If an older adult has limited life expectancy, cancer screening may not bring any benefit, but the tests may cause stress, pain, or dangerous problems. So we must always consider the person's goals and the time needed for benefit. Overtreatment can also happen with hospital care. Not every older adult needs a strong hospital level treatment. Sometimes comfort focused care at home is better, safer, and kinder. The key is to match treatment with the patient's goals, health status, and expected benefit. When we avoid overtreatment, we prevent harm and give care that truly helps. This approach respects the dignity, comfort, and wishes of the older adult. So, respect goals and capacity. Respecting goals and capacity means understanding what the older adult wants and what they are able to do. Every person is different. Some want peace and comfort. Some want to stay at home. Some want to stay independent, even it means less medical care. So we must ask the patient what their goals are. We should also assess decision-making capacity. Can they understand their choices? Can they explain their wishes? If they can't, we speak with family or caregivers to learn what the patient would want. These conversations help us avoid unwanted treatments. For example, some older adults do not want feeding tubes, ventilators, or ICU care. Others may want all the possible treatments. So we must listen without any judgment. Respecting capacity also means helping patients make choices. We explain options in simple words. We describe benefits and risks. We avoid pressure or fear. We make decisions together. When care matches the patient's goals, they feel heard and respected. Families feel more at peace and the care becomes more meaningful and less stressful. So, respect for goals and capacity is the foundation of ethical and compassionate geriatric care. Now we bring all the pieces together. Caring for older adults is not about rushing or doing more tests. It is about slowing down, thinking broadly, and seeing the whole person. It means using the 5 M's: mind, mobility, medications, multi-complexity, and what matters most in every visit. It means remembering that illnesses may show in strange ways. Confusions, falls, weaknesses, and behavior changes may be signs of serious illness. It means reviewing medicines often and stopping anything unsafe. It means checking mobility, vision, and hearing. These simple checks can prevent falls and injuries and other complications. It also means making small, gentle changes rather than big, aggressive steps. Many older adults improve with good hydration, safe exercise, fewer medicines, improved lighting, or support at home. Most important, it means listening. Listening to their story, their fears, their goals, their dreams, and their hopes. Older adults deserve care that respects their life experiences, supports their dignity, and when we combine medical knowledge with humanity, we create wise, kind, and effective care. This is the heart of geriatric approach. So thank you for caring about older adults. Your gentle approach can protect them, comfort them, and help them live with dignity and joy. So thank you for your patient hearing. If you like my video, please share it and subscribe it. Thank you again.